From University Drive to Princess Margaret Hospital, you're in the heart of the capital. This is Mango News Network. Your campus, your news, your network.
Good evening, Bahamas. I'm Nate, and we're on a story today that is grasping the social media attention. And here we are at Domingos Hospital. We want justice! We want justice!
Good afternoon. I'm Kylina, and I currently have the parents with me. Let's see their experience.
I don't know what to say. I feel like Mingo Hospital failed me. Nobody listened to my needs and my birthday plan, and I just feel like we need justice. I can't even talk right now. I don't know how to feel.
I'm now here with the dad.
We've had an awful experience at Mingo's Hospital. We came in, we had our plan put together, our wonderful midwife, a whole natural plan, and when we got here, they screwed everything out. At this point, our firstborn is in the NICU. We don't know what to do. They're not calling. If our calls, my wife is just have a seat. Thank you. She's just it's a lot. It's a lot. We need justice at this point. We need folks to hear our story and not have it brushed under the rug as everything else.
We want justice. We want justice. We want justice.
Just received news that there was a video posted that actually tells the truth of what happened today. Let's take a look. Take it away, Caitlin.
Hey, doll, how you doing?
Hey, Gwen, how's it going?
How you doing?
Girl, that right there.
Now, the doctor should be here soon.
This is
Hopefully,
quick.
y'all.
She need to hurry up.
Let's move in. No offenses. Yeah, y'all. You okay? You good?
Okay.
Breathe in. There we go.
Hi guys.
Hey, Doc. How's it
Hey, how
going?
you doing?
It's going good. I'm Dr. Jade. I reviewed the notes from your midwife. You've been in labor for a very long time
Out
now.
from yesterday. It's
Wow.
rough.
But your water has broken,
Mm-hmm.
and from your water breaking, we've seen that you have some light meconium staining.
What does that mean?
Oh, yeah, what does that mean?
Miss, she no doctor, you know. How's she supposed to know if the meconium stain?
When the fetus passes meconium before birth, amniotic fluid is now labeled as meconium stained liquor, or MSL, due to its presence in the fluid. Healthcare providers then categorize this liquor into 3 categories, with the goal of assessing fetal distress and the need for neonatal resuscitation. Category 1 is lightly stained, green or yellow. 2 is green or yellow with particular matter, and 3 is the thick, dense pea soup consistency, which indicates a high risk of MAS.
What does that mean, Doc?
It means that your baby is distressed, and due to the distress, they have passed their first stool while in the womb. So, what that means is we need to keep monitoring you, and you may need a C-section.
C-section? Hold on.
No.
Listen.
No.
Hold on.
We have a plan.
We already had our
birth,
whole
you
plan
have a
set.
doula. All Sunday say no.
I can't do surgery. I can't do a C-section. I can't do a C-section. I don't want that. I don't want that.
Listen.
I don't want that.
That baby swallows.
I don't want
it
that.
could be bad, and that could cause pneumonia.
But can we wait? Is it urgent? Like, can we wait it out some bit? I know it's a money thing for y'all at some point, but we can just, she's
I don't
okay.
want that. I'm not
She
getting that. I'm
from
not getting
yesterday,
that.
I actually, I won't hurt.
I'm not doing that.
It won't hurt.
We
Extra
I
hour.
tried, but
We
listen, you
appreciate
don't
it.
want that.
We understand, and I must respect your refusal, but please understand that you are going against medical advice.
Doctor, we
We
do
understand,
that.
Doc.
But
We
the
know
risk
that.
of your baby inhaling that meconium is very high.
She'll be okay.
I understand, but
It
we
won't
ain't
happen.
doing that.
We'll be okay. Natural birth.
Okay.
We shouldn't have come out there. Pray for me.
I tell you we shouldn't have
I
done
can check
that.
on y'all.
We have to call Jimmy.
Okay?
See something in Mario. Yeah. Apparently that birthing center wasn't working. I tell her she shouldn't have started from the beginning. Anyway, I'm gonna go do this quick interview and then I can call you later. Okay. Camera ready? Okay. So I was telling Jamario, meconium blocks and irritates the newborn's airways, which could lead to difficulty breathing, hypoxia, and decreased oxygen delivery. But no, she wasn't hearing that. She didn't care about the baby. But maybe I shouldn't say that, because that would be bad judgment. But, come on, why risk these? Just have the C-section. We are live back in the studio where I've just learned from Nurse Quant that meconium blocks can also cause atelectasis and air trapping, worsening lung function. Reduced oxygen levels can also cause brain injury and organ dysfunction, and is strongly associated with persistent pulmonary hypertension of the newborn, increasing risk of respiratory failure and mortality.
I shared the nerve to ask me what would happen if she didn't have the C-section and if her baby swallowed meconium. Meconium aspiration syndrome. Meconium aspiration syndrome is a serious neonatal respiratory condition that occurs when a newborn inhales or aspirates a mixture of meconium, the baby's first stool, and amniotic fluid into the lungs before, during, or immediately after birth.
I'm recording, hon. I got everything.
The head is now crowning, but the amniotic fluid is thick. We have thick meconium like pea soup.
Oh my gosh, alert the NICU team!
NICU team here.
My baby okay?
They're
My baby okay?
They're not doing anything. Look,
I don't hear her crying.
a whole baby born and it's still doing nothing.
Oh my god.
Listen, I hear you. I know how it looks like we're not doing anything, but we're watching your baby very closely. Right now, we're checking their breathing, their oxygen levels, and how well their lungs are working. Sometimes moving too quickly can actually cause more harm, so we start with gentle support first. We're giving oxygen and making sure the airway stays open. And if we see that your baby is struggling more, we're ready to act immediately. That could mean helping them breathe with a machine, placing a breathing tube, or in very serious cases, using advanced support like ECMO, or extracorporeal membrane oxygenation to take over the work of the lungs. So even though it may not look like much is happening, every second we're assessing, supporting, and making sure your baby gets exactly the care they need. Bring in the baby.
Don't stimulate the baby. If he cries, meconium goes deeper.
Suction the airway now. I'm getting thick plugs out of the trachea.
Heart rate is 70 beats per minute. Start oxygen support. Claire, give him a breath. Heart rate is rising. 100.
A few moments later.
120. He's pinking.
So as a part of the NICU team, you can tell the father was just overwhelmed from the moment we came in. So much is happening. So we're focused on clearing the airway and monitoring the baby and making sure that the baby is okay and breathing well. And he's recording and raising his voice. It's a lot going on, especially in that type of environment. But you could see it wasn't just anger. It was fear and not really understanding what we were doing. Psychologically, families can feel helpless in those moments, especially seeing their baby in that position. And it can quickly turn into panic, and you could tell they were just really struggling, trying to process everything that was happening right in front of them.
Then the father had the audacity to say that we didn't start working on the child until he brought out his camera. Like, me and my team wasn't working vigorously to make sure we monitor the baby's vital signs, monitor the baby's breathing, as well as the baby oxygen level. Plus, on top of that, we were suctioning the baby and giving the baby ventilation if needed. And we were also making sure the baby was warm because their hypothalamus is premature, which means it doesn't work properly. So we have to make sure that the baby stays warm at all times. We have to limit infection, and we have to make sure we keep the family updated and educated on what's going on with their child.
Now, I ain't gonna lie, this situation really have me stressing a little bit, especially with the parents not wanting a C-section. Because as nurses, we still have to respect their wishes, but also ensuring that the baby is still safe. Surgical management of meconium aspiration syndrome isn't the first line of treatment at all. Doctors would always try things like ventilation, oxygen, or even suctioning. But if the baby is still not improving and still showing signs of severe respiratory distress, then more severe interventions come into play. One major option is ECMO, which is basically a life support machine that takes blood out of the body, adds oxygen, removes carbon dioxide, and sends the blood back in the body. This machine allows the baby's lungs to rest and recover. In more severe cases, the baby can develop something called pneumothorax, where air leaks into the chest space and stops the lungs from expanding properly. And that is when a chest tube has to be inserted to remove the trapped air and to help the lungs to expand. All of these are done normally in NICU with close monitoring and is only done when the baby is critically ill and not responding to standard care. So, overall, surgical management is really just about supporting the baby's breathing in extreme cases and preventing life-threatening complications while still giving the baby a chance of survival. Now, you tell me, that ain't so bad, right?
We'll discuss the medical management of meconium aspiration syndrome. The main goal is to help the baby breathe properly. We may suction the airway at birth if needed, then give oxygen. If the baby is in distress, CPAP or ventilator may be used. Surfactant can also improve lung function. Antibiotics are given to prevent infections, and nitric oxide may be used for complications. In severe cases, ECMO or a chest tube may be needed. Overall, treatment focuses on supporting the baby, breathing, and preventing complications
in the newborn. And while the focus at this point in time is generally on the physical health of the baby, it is equally as important that we give time and attention to the psychological impact that it has on the mother, especially after the postpartum period. Mothers during this point in time often experience intense anxiety when their baby is admitted to the ICU. Their fear is centered around the baby's survival, long-term complications, and you'd find that the anxiety may present as restlessness, constant questioning, or even difficulty with sleeping. As it relates to fear and guilt, you do find that mothers oftentimes blame themselves for this outcome, even though we've said countless times throughout this presentation that meconium aspiration syndrome is often unpredictable and even more so unpreventable. Common thoughts they go through or that they ponder upon include, did I do something wrong? Was it something that I ate? Something that I shouldn't have done? Something that I should have done? Or could I have prevented this? This can negatively impact emotional recovery after delivery. There's also, as mothers are always taught, there's the importance of the maternal-infant bond. There's a disruption in that bond at this point in time. The immediate separation between the mother and the child interrupts the skin-to-skin contact and the early breastfeeding. And this oftentimes leads to a feeling of detachment or delayed emotional contact. It is important that we note that this is temporary and certainly reversible with the right support. Mothers oftentimes experience emotional distress and grief. Mothers begin to grieve the loss of their expected birthing experience. They've gone through this for 9 months and have the ideal scenario in their heads, and oftentimes this is not the case once faced with such an outcome. Emotional responses may include crying spells, mood swings, or even feeling helpless throughout the ordeal. There's also, we must focus on, at this point in time, the risk for postpartum depression and post-traumatic stress disorder. Prolonged stress can increase the risk of postpartum depression as well as PTSD, especially if the baby's condition is severe or there was a traumatic delivery. The final thing that I want to point out to us this evening is the hypervigilance and emotional exhaustion that mothers endure during this point in time. You find they oftentimes become overly alert to monitors and staff interactions, and over time they become mentally and physically exhausted. Sleep deprivation, of course, will worsen the emotional strain. We as nurses are urged at this point in time to ensure that we are providing patients with the appropriate emotional support and reassurance, encouraging the mother and infant bond whenever possible, and involving family support systems as much and as often as we can. In summary, again, I remind you and I remind us all that meconium aspiration syndrome affects not only the newborn, but also the mother's psychological well-being. Early recognition and supportive nursing can certainly help to promote healing and recovery. Thank you.
The mother and the father, the baby's lungs would have been coated with the meconium, and that would have caused a fatal death.
Medical expertise isn't a suggestion, it's a lifeline. Before you share something, make sure you have the full facts.
I'm Nay.
And I'm Kailena.
And this is Mingo News.
Thank you.